again, we're now going into the fourth dimension of the model, of the theoretical model of transcultural caring dynamics in nursing and healthcare. So this area is called universal sources, and it's really the spiritual and the religious foundations of understanding for us when we're sharing with our patients. So as I mentioned, I called it universal sources as opposed to any specific religion. We can look at religions, Christianity, Judaism, Islamic culture, Islamic religion, Hinduism, all of the different religions, because they play a role in how a patient believes about their own health and well-being. And even though in nursing often we haven't addressed the spiritual component of our work a lot, it is very significant when we talk about nursing as holistic, which means really body, mind, and spirit, and we often call our discipline holistic. And so we then have to be cognizant of this notion of spirituality. And also spirituality doesn't necessarily have to mean a religion. It can mean for many people, it can be their creative part of themselves, for example, if they're not religious. But as we know, when a patient enters the hospital, there's usually a section on admission, where a person can put in their religion, and then either a chaplain or a social worker, and hopefully ourselves as nurses, we can look at what might be in that particular area so that we can address the holistic part of the patient, body, mind, and spirit. So when I wrote this chapter in my book, I mainly sought out to explain some of the principles of the different religions, the more historical religions, and gave an understanding or presentation of the central precepts of these different religions, so we can understand the patients with whom we interact with. And so these standards or spiritual or religious traditions do shape the meaning of health and healthcare. And so I urge you to take a look at my book, because I've identified these major religions. I won't go into all of them now, but when we see patients, the religious traditions are from birth to death, to the dying process, and we need to be aware of them so that whomever we're caring for, that we can address what those spiritual needs are, and be open to those needs. Years ago, when a patient died, and when I was a young nurse, we used to prepare the body. We used to wash the body. We used to put the shroud on the body and get the patient prepared for the funeral director or for the morgue, and especially before putting on a shroud, for example, we would have the patient all prepared for family members to participate in prayer or other kinds of religious activities before the patient would be leaving the institution. So it's just, again, as a transcultural nurse, that this is a significant part of the well-being of a patient or the well-being of a family member, and being open to either asking questions so that we can help people within this dimension of their life world. Dr. Katie Erickson, who is a nurse from Finland and who has written on caring, she talks in her writings about this idea of how do we help the patient through the idea of suffering. Sometimes in our work as nurses, we haven't, we might have paid more attention to the elements of the physical and emotional components of our patient, but not on elements that are associated with the spiritual, which is often suffering. And we might give a pain medication to the patient, to ease their pain, but many patients might also be experiencing a type of spiritual suffering. And so Dr. Erickson's work really helps us to understand as nurses what the spiritual element really is, and it goes deeper often than just addressing maybe a component of a particular religion, but really how this, as part of our holistic nature of nursing, body, mind, spirit, how do we help a patient through some of these spiritual means. So as a part of the dimension of my theoretical model, I'm always hoping that I can help nurses also address this spiritual component for patient care and for providing what I would call excellent transcultural nursing. And so this is an important dimension, and often we can't just leave it to the chaplain. It's also part of the whole holistic and health nature and healing, actually. When we talk about caring, we also talk about healing. So as part of my theory and helping you to become transcultural nurses, I would like you to also include this element into your transcultural nursing care.